Hello, and thank you for joining me today. My name is Dr. Phil Schembri, and this session is about one of the biggest ongoing challenges in veterinary practices today, especially in the UK. The wound healing that is slow, it's costly, it's frustrating for both vets, owners, and many clinic practitioners. Today, I'll introduce the Ematik PRP wound patch, a biological solution designed to accelerate healing in animals, particularly in the types of wounds that traditionally take weeks or months to resolve. We're talking about small animals, medium animals, or even larger animals such as cows and horses. Across England, vets consistently report that wound care is one of the most time consuming and unpredictable parts of practice. Common challenges include high risk infections, especially in outdoor and limb wounds, slow granulation in distal limbs due to poor blood supply and motion, heavy bandaging workloads for nurses and vets, wound breakdown and dehiscence, and increasing owner frustration with both cost and duration of treatment. And these challenges don't just affect outcomes, they affect the workflow, the morale, and the client satisfaction. The wounds vets find most difficult are not necessarily the largest ones, but the most biologically challenging ones. These include the limb lacerations, particularly below the knee and the hock, wounds with exposed tendons or bones, proud flesh, cases where healing becomes deregulated, bite wounds with deep contamination, and surgical wounds that break down the Hoff and cornet band injuries, and clinical non wound healing or non healing wounds that simply stall. These are exactly the wounds where conventional dressings alone often fall short. I'm going to be putting this into practice. I would want to put a few clinical studies together where I'm showing you the different types of animals and the wounds that have been treated with this particular patch. The MTech patch or MTech PRP wound patch combines two powerful elements: autologous platelet rich plasma and a bioactive scaffold. This allows direct delivery of growth factors to the wound bed, sustained release rather than just a short burst, reduced inflammation, improved angiogenesis, and faster epithelialization of repeatedly managing the consequences of poor healing. Emetic dressing, the biologically healing itself. Here, these are the ranges of patches. They come in three different sizes, but as you have seen before, they can be also cut to size to the required wound formation that you're trying to apply it to. What this translates to clinically is significant. First, faster granulation, often between 50 and 70% quicker than conventional wound bandages. Reduced need for systemic antibiotics, fewer dressing changes, better quality tissue formation, and improved functional and cosmetic outcomes. For the vet, this means fewer complications, and for the owner, it means faster recovery and lower total cost. A case study with Charlie, a Jack Russell with a lot of spirit, a traumatic wound to the inner thigh of over 10 centimeters. Wound was first cleaned with saline and a single impregnated patch placed on top of that, as you can see in the completed. It completes the wound heal better than anything else that's available to them. And then we have Shopi. Shelby had an extended lesion across the entire thigh and the foot. It's a big extension and probably caused by an insect bite, such as a caterpillar, and was treated with salt and water by another facility in another hospital, which didn't go away, and they very much had a very hard time healing this wound, as many of you had probably seen this before. Well, the wound hadn't had much improvement, so we used the PRP patch, and as you can see at 50 days, you can see a very big improvement, a complete heal of the wound. Now we're going to look at Berber. Berber was a patient with phlegm and an ulcer infection, which was previously treated with antibiotics, but didn't always work. There was a constant infection that came about. We then placed the PRP patch on the wound and we stored some of the PRP in a freezer just for a follow up to maybe apply it again. Ultimately, we did apply it again, and Berber had another round of the PRP patch. And as you can see, it's 16 days, and this was the result. And then we see at 85 days a complete heal of the wound. Horses can be a big problem, and saccharoid on horses are a big problem for many of the vets, and a biological application could be a solution. However, by sustaining the flow of delivery to the tissue has seen a greater effect. Here, a suturing of the PRP patch, which was impregnated by the PRP, and we sutured it to the site itself. We were able to have a good steady flow of the PRP to the site, and at 28 days has already seen a size decrease, and at 62 days, a high reepithelialization of the basal portion. I would like to note that at 15 days, an exposure we gave to the air had been given before the application. Even through just a surgical procedure, you can see that there's many challenges that can happen. Dehiscence, wound not closing, infection at the suturing sites. Well, you can see from this picture, you can see that the patch can play a significant role in the consistent healing to close the wound and provide an acceleration of the wound site. In surgery, this can be done by simply impregnating the dressing before cutting to size, as you can see on the screen, before placing along the surgical wound. As you can see, we cut in very small strips and we place it directly to the surgical wound where the suturing will be. There are many applications for the PRP patch, and it can be used in such as the surgical setting, different wound pathologies, and even the use for wound infection control. PRP is a very good tool and sometimes underrated, and can be used for joint injections also. Some may just look at the interleukin or the buffy coat as just the optimal tool, but we class PRP has so many different effects and good components within the platelets. Let's use everything we have in there, such as VEGF, platelet derived growth factors. Most of the growth factors together can create a different mediation. Now let's talk about costs, because these are also important. Because this is the major concern for many owners across the UK and across Europe. A single wound visit can cost maybe 150 to £300. Weekly dressings often add to 80 to £150, and chronic wounds commonly exceed 1,000 to 3,000 over time. And these figures don't include the owner time, or repeated call-outs, or referrals, escalation. Costs become the limiting factor long before the clinical options are exhausted. So let's break this down a little bit more. So when we look in the clinic, we can find these are the cost areas. This is a topical cost in the UK, the frequency we can find in the UK for the dressings, and the monthly cost that's outgoing. When we compare this, we're looking at a typical cost between 400 to £2,000 for a specialist referral, and even a vet call out between 50 to £80. A monthly ongoing cost can rise up significantly. Now, what we're going to do, and this is just for equine, but what we're going to do is we're going to compare this cost of equine wounds to what we would do with a wound PRP patch. The cost of the PRP patch approach is estimated to saving a horse wound between £575 to 2,340. It's made up by applying the blood draw at 50 to £100. A single PRP patch consumable between 60 and £120 is placed on the wound and is left to absorb many of the wound and apply the healing delivery. The application fee between 60 and £120, depending if it's one of the surgeons or if it's one of the nurses, but totally we're looking around 170 to £340 per wound, which is a very big savings, and I'm sure you'll agree. My name is Dr. Phil Schembri, and what we do at Cell PRP is bring very high significant devices and technology to the UK market. Thank you for watching this presentation. And the message we find from here is longer the PRP application, the faster the healing. You can call us, you can email us, please visit our website. We are nationwide and we're able to come into your practice with maybe a few of these patches for you to see the application firsthand and give it a go. If you have any questions, please give us a call or please get in touch and we'd be happy to answer any questions you have. Thank you very much.